Seasonal affective disorder, or SAD, is a type of depression which typically affects people during seasonal changes. Many people feel sad and unlike themselves during these periods and often find themselves with the winter blues when daylight hours decrease during the fall and winter seasons. For others, these blues can be more severe and impact a person's feelings, thoughts, and behavior. This is SAD. The symptoms of this disorder tend to present themselves in the late fall or early winter months and disappear during the spring and summer. This is known as the winter pattern SAD or winter depression. There is also a less common form of the disorder, summer pattern SAD, where symptoms appear during the summer months. What causes SAD? While the exact cause of SAD is not fully understood, several factors are believed to contribute to its development. Serotonin, a hormone, plays an important role in mood, appetite, and sleep regulation. Research shows that sunlight is associated with the body's production of serotonin. Insufficient sunlight may decrease serotonin levels, which in turn can cause depressive symptoms. Melatonin is a hormone that regulates sleep-wake cycles and sleepiness. In individuals with seasonal affective disorder, SAD, it is believed that higher than typical levels of melatonin are produced, possibly due to the lack of sunlight. This disrupts the natural circadian rhythm and can cause symptoms such as fatigue and depression. The circadian rhythm, or body's internal clock, uses sunlight as a primary means to time key functions, like waking up. Because of this, the reduced light levels during winter can disrupt these natural timing signals and cause symptoms of seasonal affective disorder. There are risk factors for SAD include the following attributes. Gender. Women are significantly more susceptible to SAD with a diagnosis rate 4 times higher than men. Geography. Individuals residing far from the equator, specifically in northern or southern latitudes, are prone to SAD. For instance, the prevalence of SAD is higher in Florida compared to New England or Alaska. Genetic predispositions. Family history plays a role, as those with a family member diagnosed with depression are at an increased risk of developing SAD. Mental health conditions. Pre-existing depression or bipolar disorder can exacerbate seasonal depression symptoms. However, SAD is diagnosed only when seasonal episodes are the predominant type. Age. Younger adults are at a higher risk compared to older adults, and SAD has also been reported in teenagers and children. Signs and symptoms of SAD. Seasonal affective disorder, often mistaken as a separate disorder, is actually a type of depression. The key feature of this depression is its recurring seasonal pattern. To qualify for a SAD diagnosis, an individual must experience major depression during specific seasons, typically winter or summer, for at least 2 consecutive years. Furthermore, the seasonal depression must occur more frequently than any non-seasonal depression to be classified as such. Major depression is a mental health condition that significantly impacts daily life. Sufferers often feel depressed, hopeless, and worthless, alongside a low energy and a lack of interest in normal activities. Other symptoms include sleep and appetite disturbances, sluggishness, difficulty concentrating, and thoughts of death or suicide. The winter pattern of seasonal affective disorder, on the other hand, is characterized by low energy, excessive sleep, binge eating, weight gain, and a preference for carbs. People with this pattern often isolate themselves from society. The summer form of SAD is less common. Sufferers may experience poor appetite and weight loss, insomnia, agitation, restlessness, anxiety, and in extreme cases, episodes of violence. While these symptoms are key indicators, the diagnosis and treatment of these disorders should always be sought from a medical professional. Effective ways to ease seasonal depression. People with seasonal affective disorder need to confirm the diagnosis by visiting a mental health specialist. This is because it is a type of depression that varies in symptoms, severity, and danger. The specialist will check the symptoms that the patient is suffering from and whether they indicate seasonal affective disorder or not, and accordingly determine the appropriate treatment for the case. Preparing yourself for the arrival of winter is an effective way to deal with seasonal affective disorder. This is because people often suffer from SAD when transitioning from autumn to winter. Preparing yourself can include spending time doing fun activities that boost your mood and maintain physical and mental health, such as having conversations and going on walks with friends, practicing new fun hobbies, joining community service groups. Phototherapy or light therapy is a common way to prevent seasonal affective disorder symptoms and overcome them before they occur. This involves exposing a person to bright, full-spectrum light, usually for 10-15 minutes daily, increasing to 30-45 minutes daily depending on the person's response to treatment. Dawn simulator devices are one way to overcome seasonal affective disorder. These are alarm clocks that, instead of making a sound to wake you up, they produce a light that gradually increases in intensity, mimicking the sunrise. There are different models of dawn simulator devices, but the best ones use full-spectrum light, which is closest to natural sunlight. Antidepressants can be prescribed by a physician to overcome seasonal affective disorder symptoms if taken at the beginning of winter before symptoms manifest and continued until springtime. Making lifestyle changes is a great way to mitigate seasonal affective disorder symptoms. Some of these changes include exercising regularly, including brisk walking for 150 minutes per week. Eating healthy, balanced meals. Avoiding situations that trigger symptoms and taking effective measures to manage stress and anxiety. Aromatherapy is a popular method to reduce symptoms of seasonal affective disorder, depression, and other mental health issues. Essential oils affect the part of the brain responsible for mood and the body's internal clock, which regulates sleep and appetite, helping to improve mental health, especially when combined with a calming activity such as a bath or candlelit evening. As low levels of vitamin D, whether due to insufficient sunlight exposure or lack of dietary sources, is a potential cause of seasonal affective disorder. Taking vitamin D sources, getting adequate sunlight exposure during the day, or taking dietary supplements can reduce symptoms of seasonal affective disorder. Please check sources in the description box. Thank you for watching.